So we have some time for questions, and I'm going to start off with a few questions. If there are other panelists who have questions of others on the panel, then you can ask them as well. But let me start off with Laura and Bob. I'm interested when you do this education, when you show up at the fairs or the other venues, what kind of reception do you get? How seriously do people take what you say? And is there any evidence that they take what they've learned from you and actually act differently? That in their own do-it-yourself renovations at home or otherwise, that they actually take actions based on what you're able to inform them about?
Well, that's a good question. Thank you. I'll just back up a little bit to the film yesterday, Dirty Laundry. You saw a little bit of the Ambler community. Ambler is a very small municipality, and it's old. The Keysby Madison asbestos factory began in the 1800s. Ambler's on the Pennsylvania Railroad line. I mean, if you know the history of Ambler and the asbestos legacy, it's been around a long time, but it's fast becoming a very boutique community. They do have these annual events, spring and fall, Christmas parades. It's only about 4 blocks long, but it's some of the old mom and pop shops are still there, but there's galleries and restaurants and boutiques, and the municipality isn't really fond of us talking about asbestos, but we do it anyway. We had a booth at the Oktoberfest 2 years ago. Last year, there was nothing. This year, but 2 years ago, and we're surrounded by tents with vendors, with candles, and all sorts of wonderful things that you see. And there we are. And Tony Rich was there with his display, and we really just, sometimes we need people to come to us, but when we get them, we share. And most of them say, we didn't know that. We didn't know there was still asbestos. We didn't know, and neither did we.
Yeah.
And that's really why we're here, because we didn't know. So we try to make sure we enlighten people. They're surprised what they do with that. We don't know, but we give them the information.
Yeah, and like Laura said, or you had mentioned, it's sometimes it's a tough sell, but I didn't know. I was in construction for years, but my misunderstanding was it was in the attics, and that was pretty much it. And I didn't realize it was in the tile floor, the mastic in the floor, inside sheetrock and firewalls and this and that. And I've had, when we do these events, there are breakthroughs. I've even had construction people take that flyer and like, really? I didn't know it was there. So there are positives, there are shining lights. But it's a tough sell in Ambler. People want to forget about it, but there are the realists who realize like it's still an issue. So.
Yeah, makes me think that if there is success in setting up a registry of exposure or an inventory of exposure across the country in the U.S. from existing materials, that there's going to have to be a massive education job to get people to understand what it means that those materials might be in your living space. Question for Andrea. We talk about early detection of lung cancer, and we've got this nice X-ray technique to do that. I know there's been a lot of work on early detection of mesothelioma, and I'm talking about mostly mesothelioma in the chest, because most mesothelioma is in the chest. I know how it's extremely difficult to come up with a method of early detection of mesothelioma by nature of the disease. But what are the real prospects? Because I know people have been working on this for at least a couple of decades. I know you're working on it. And are we getting close at all?
I don't mean to be a Debbie Downer, Steve, but not really. In fact, one of the comments I was going to make to Laura was that you guys are doing so much more for prevention, awareness, early detection than I can do. Unfortunately, the low-dose CT is probably the best I have right now also. And even that, as you and I know, and as many of us see, often doesn't detect it. We have many patients who've had the disease for years who go without a diagnosis, even in the setting of symptoms and signs of the disease. Unfortunately, patients come to me with years of recurrent pleural effusions or fluid accumulating between the lung and the rib cage. And they've had multiple procedures, sometimes invasive procedures. I had a patient of Al Tiersten's who had such a case and had surgery and had operative biopsies without a diagnosis until he had presented with later stage disease. And so I wish I could give a more optimistic outlook in terms of early detection, but the best we have is to assess people's exposure, to know who to follow closely, and to have a very heightened suspicion in the setting of anything abnormal. And for patients who have had exposure, the best I can recommend right now is a low-dose CT.
Thank you. And fortunately, it's the same low-dose chest CT that's used for detect lung cancer as mesothelioma in the chest. So it's not a second medical test. It's the same test. So when people show up for their early lung cancer detection, they're also getting what may be a technique for early detection of mesothelioma. But on a hopeful note, I know there's a fair amount of work on this and interest in early detection of mesothelioma. So hopefully that work will be supported and continue. Let me turn.
I just want to make a quick plug before we move on, just on the subject of the economy of that early detection test. We get a lot of bang for that buck. And so we also get a calcium score, which assesses coronary risk factors. We also get breast cancer detection with those scans. So just to make another sort of plug for the low-dose CT.
And not to pile on, but we screen 14,000 people with low-dose CT. We also can pick up aortic aneurysms, which can be corrected. So that, and the occasional kidney cancer, which can also be resected. So there is a lot of benefit from the low-dose CT. Let me move on to Dr. Moline. On the same vein, actually, of early detection, because ovarian cancer, affects 35,000 women, or at least maybe it was deaths. I don't recall exactly whether it was deaths or number of cases, but in any event, a lot of women. And there has been work on early detection of ovarian cancer. And what are you aware of sort of what the status of that is? Or I know we don't have a screening method for ovarian cancer, but I know there's been work on it. Can you fill us in at all?
Yeah, thanks, Stephen. It's one of those insidious cancers, and by that I mean it takes a long time for the symptoms to appear in many cases, and they have looked to see if people at high risk, and there are certain groups of people who may get screening, those who may have a genetic mutation, the BRCA gene, where there's an association with increased risk of ovarian cancer and breast cancer. It's a family cancer syndrome that may get in some cases, people get prophylactic ovarian removal if they have already had children, or they will to prevent them because they are at very high risk. But for the general population, despite looking to see if ultrasounds, which are an easy screening test, doesn't require any needles or actually any radiation per se, have been effective in identifying or earlier detection, and they haven't. So they've tried, there have been large scale clinical trials to see if any screening tests do work. But they haven't found that, except for these very small groups of folks that may avail themselves of screening on a more regular basis. It's really one of those, again, it's you have to let your body speak to you. And if you begin having unusual symptoms early, and this goes for mesotheliomas as well, which is, to Andrea's point, or to Dr. Wolf's point, when a patient that I'm seeing that I know has asbestos exposure shows up with a pleural effusion, I just send them right to Dr. Wolf or one of her counterparts, because I know that chances are they're not going to find any fluid, or they're not going to find any cancer cells in the fluid, yet they may be an early stage cancer. For ovarian cancer, we need to make sure people are aware of the early symptoms so that they can get checked out, so that it can be early detected. And it's really one of those prevention by understanding what the early symptoms are, which are, again, non-specific.
Yeah. And actually it raises the point that, the level of care, the understanding of the diseases, the medical surgical skill is really so much better at the places that are dedicated to this. I mean, Dr. Wolf's New York Mesothelioma program, there's a comparable one in Boston, in Houston, and some other places. But for people who don't live in those areas, who are beginning to have problems that could well be mesothelioma, it is definitely worth looking to those facilities to get proper treatment and the like. Brad, maybe you can straighten something out for me. I've heard Linda say that richterite, which is part of Liviamphibole, is also known as sodium tremolite. Of course, tremolite is a recognized asbestos fiber. And so I don't know if this is, I know you're not a geologist, so just, forgive me if this isn't your area, but is richterite a name that is sort of an industrial name? And should it be considered sodium tremolite for the purposes of classification? And this is not an esoteric issue. This has to do with, how it might be treated under a ban, et cetera. So Brad, can you fill me in here?
Well, when you get into that world of description of minerals, you'll find nomenclature changes on you. And of course, for years, the fibers that contaminated this vermiculite deposit were called sodium-rich tremolite, and so they had various names for it because they really couldn't categorize it as well. But certainly when the nomenclature changed, somewhere in I have to remember, the late 80s or something. Anyway, a lot of the deposits were never restudied or re-examined and characterized for their fiber types, even though nomenclature had changed. So when the situation broke in Libby, the USGS restudied the mineral content at the mine site and realized that most of this was not tremolite. Most of it was richterite and winchite being the most predominant. 84% of the fibers were winchite, which is non-regulated, and richterite, once again, another 15% non-regulated. No, I don't think we can squeeze it in on that. We're still stuck without a regulatory recognition, unfortunately. And I think, mainly, I don't know. There are a lot of excuses, I know, and probably one of those is there's pushback because Libby's not the only place that has these types of fibers. It just happens to be a place where we exploited another mineral for commercial use that had to be contaminated with them. But across the country, there we've found other deposits of minerals near the surface that are similar types of fibers, such as in Nevada and other places around the U.S. So it's just unfortunate when you had a product like vermiculite, which was a good product, and we don't know of hazards from it, had to have this contamination, unfortunately. But I don't think we're going to squeeze them in, or we're stuck with trying to get the recognition as separate regulated fibers. And I think going forward, it would make a lot of sense to have them regulated. We're going to run into it again when we're doing activities, whether it's in road building or other things that we do. We're going to run into these in different parts of the country, and to have a regulation on them now would be extremely important in my mind.
Okay, thank you, Brad. That really did clarify it. Thank you. I want to thank the panelists. I thought it was an excellent panel, very, very informative.